My presentation was on narcolepsy. Okay, so narcolepsy, which comes from the words narco, which is to sleep or stupor, and lepsy, which means seizure, is a brain disorder characterized by the lack or loss of hypocretin in the brain in the lateral hypothalamus, so it's considered a hypothalamus disorder. This causes a dysfunction of the sleeping patterns of the individual. This causes REM sleep to start early in the sleeping projects, which is abnormal and causes excessive daytime sleepiness. There are two types, type 1 being the more common and obvious of the two, whereas type 2 is more of like a borderline disorder or one that's harder to spot. Some of the symptoms of narcolepsy is cataplexy, and what cataplexy is it comes from the words cata, which is down or under, and plexy, which also means seizure. And cataplexy is the sudden weakness or paralysis of your muscles triggered by emotion, which means that if you were surprised or scared or really, really happy, that your muscles would just kind of stop working. Sleep paralysis is also pretty common in people with narcolepsy. There's hypersomnia, which comes from the word hyper, which is excessive, and somnia, which is to sleep, which basically just means you sleep too much. People with narcolepsy can sleep up to 20 hours a day, as they never really get satisfied with their regular sleep. There's hypnolepsy, which is basically an attack of sleep, which is kind of like hypersomnia, but it's just sudden and you will just randomly fall asleep at any given point. It can just happen while you're sitting, standing, you can be driving, which is dangerous. There's hypnagogic hallucinations, and what hypnagogic means is it's before you sleep, so while you're falling asleep, you'll have like auditory or visual hallucinations. There's the bilateral loss of muscle tone, so on both sides of your body, you will lose muscle tone, which also can come from the lack of sleep that you're getting. And with narcolepsy, a lot of these symptoms can be mixed, or you could just not have some of them, depending on the type you have and the severity of it. Like I said before, the medical reason is the lack of hypocretin in your the lateral hypothalamus, but through lots of environmental sleep disruption factors that may cause it are excessive naps, which are, they throw off your sleeping schedule, which may cause this. It can also be caused by sleep apnea, which is basically while you're sleeping, you aren't breathing, which comes from A, which is not, and apnea, which is breathing. So disordered sleep breathing could also cause your excessive daytime sleepiness. Leg movements during sleep, so like your legs are moving while asleep, because it's proven that while you're sleeping, if your leg moves a lot, you are getting less of a quality of sleep, and therefore you're going to be more tired in the day. Excessive daytime sleepiness, taking naps. So it all kind of just ties together. Misdiagnosis. A lot of people are misdiagnosed with other things due to a lack of information on narcolepsy and how actually rare it is. And especially in adolescence, it is misdiagnosed because, adolescents are generally just sleepy. They need a lot of sleep because of their growth patterns, but they're also misdiagnosed as many things as epilepsy, so having a lot of seizures or schizophrenia, and they're wrongly prescribed antipsychotic medication or anti-seizure medication, which may make the problem worse or just not do anything. So when these problems arise, it is really important to get checked out for narcolepsy as well and get your sleep checked out. Treatment. There's a lot of treatment things that you can do, which is lifestyle changes such as naps, even though I did say that naps could cause this or make it worse. Taking periodic naps will help the excessive daytime sleepiness, and make it a little less likely that it'll happen during dangerous times, like while you're driving or doing something important like working. Sleep scheduling in general, which is just regulating when you sleep, where you sleep. Even though with narcolepsy, it is really hard to plan when you are actually going to fall asleep. In general, if your sleep schedule when you're actually planning to sleep is regular, it could help a lot. So like having like third shifts or something like that where you're not sleeping regular could also make this worse. Diet changes, so eating healthier could also help your sleep schedule, lay off that caffeine, which can really throw off your sleep, or, excessive sugar or other things that'll just stop your sleeping. Exercise does help your energy levels, so your sleep schedule will be a little better because your energy levels are higher. Your excessive daytime sleepiness will go down a little bit. A lot of people with narcolepsy do heavily exercise, or have a good exercise schedule, as it helps with that, and they aren't as sleepy while they are exercising because they are exerting themselves. But also, besides the lifestyle changes, there are also other things that you can do. Medication-wise, Armodatil is an example of a medication that you can use, but there are also other ones that are commonly used, such as Modafinil or sodium oxybate, that you can use. So in general, narcolepsy is very debilitating and can lead to very dangerous things, but if you are using the right lifestyle changes, scheduling your sleep, getting medicated, and making sure that you are not misdiagnosed by getting everything checked out, in general, you should be on your way to semi-normal, even though this is a lifelong chronic disease that most likely will not go away and onsets around the age of 15 and so.